The program of action recognizes that healthy families are created by choice, not by chance.
That journey that began 25 years ago is far from over. It's now time to finish that unfinished business.
The Sustainable Development Goals cannot and will not be achieved until women, girls, and young people are able to control their bodies and their lives, free from fear and from violence.
Moving forward, we will not retreat. We will never give up. We are in a race to the finish line, and we shall prevail. Thank you. Nashukuru sana.
And go ahead.
And you're mute at the moment.
So, thank you. Your Excellency, Dr. Kanem, Special Rapporteur on the Rights of Indigenous Peoples, Dr. Khalid Zoe, dear Indigenous sisters and brothers, ladies and gentlemen, I would like to welcome you to What's Next Global Conversations, organized by the United Nations Population Fund on Indigenous Peoples and COVID-19, the disparate impact. The health and well-being of Indigenous peoples is materialized not only in the well-being of each person, but also in the social, emotional, spiritual, and cultural well-being of the entire community. The higher rates of ill health and susceptibility to communicable and non-communicable diseases among Indigenous peoples has its roots in the policies of colonization, including oppression, dispossession, and assimilation that continues to affect succeeding generations. As a result, the health of Indigenous peoples is weakened by a series of determining socioeconomic factors such as poverty, poor housing, lack of education, food security, lower employment rate, loss of traditional lands and languages, obstacles to political participation, and institutionalized racism. Indigenous peoples continue to be invisible as a result of non-existence or inadequate disaggregation of data by ethnicity in the national statistics and information systems, or simply because Indigenous people's identity is not recognized by the states. The COVID-19 pandemic poses a great health threat to Indigenous peoples around the world. For Indigenous women, those are more severe than they are for Indigenous men as a result of their different biological profiles and gender inequalities. In many countries, despite having a lower rate of mortality than Indigenous men, Indigenous women's rate of morbidity is higher, mainly due to their triple burden of reproductive, domestic and productive labor, which often prevents Indigenous women going to seek healthcare in or near Indigenous communities, or their inability to access culturally appropriate health services when they are available. Additionally, Indigenous women continue to experience persistent and disproportionate inequalities in access to health and healthcare services due to discriminatory practices of mainstream healthcare providers and discrimination regarding the traditional health practices of Indigenous women, such as Indigenous midwifery. Therefore, an urgent need to focus on health issues, including sexual and reproductive health, as well as on alternative healthcare frameworks that include traditional health practices. For Indigenous women, this pandemic has further increased already existing disadvantages, such as impoverishment, limited access to education, domestic violence, and routes to economic independence. Despite these challenges, Indigenous women continue to play an important role in responding to the current situation within the framework of their rights to self-determination. The Permanent Forum continues to play a role in addressing the situation of Indigenous women. Over the years, it has adopted a number of recommendations making direct references to the Indigenous women on a wide range of issues, including education, culture, health, human rights, environment.
Yes, this is Rafael calling for Shimeka, please.
Conflict and political participation. Within the context of the COVID-19 pandemic, the Permanent Forum on Indigenous Peoples has urged states and the international community to include the specific needs and priorities of Indigenous peoples, in particular Indigenous women, in addressing the global outbreak within the context of the UN Declaration on the Rights of Indigenous Peoples. And let me now introduce you, our panelists, for this for now. And first, I'd like to introduce Dr. Natalia Kanem. She's an executive director of the UNFPA. And then I'd like to introduce Ms. Tarcila Rivera Zea, the chair of the Continental Network of Indigenous Women and director of Chirapac. And our third panelist is Dr. Mariam Aboubakrine, leader of the International Indigenous Working Group on HIV and AIDS, and also member of Dinhinan Sahel. And she was also the previous chair of the Permanent Forum. And fourth panelist is Ms. Janina Jassy, who is here for the Sustainable Development Program, or works as the Sustainable Development Program coordinator and represents International Indian Treaty Council. And then we have also Ms. Pratima Gurung, who is General Secretary for Indigenous Peoples with Disabilities Global Network. And we have also here Mr. Dr. Khalid Zai, who is UN Special Rapporteur on the Rights of Indigenous Peoples. And next in our program, my former colleague, Ms. Tarcila Rivera Zea, gives us a blessing. Tarcila, the floor is yours.
Thank you. The music.
Oshero, oshero, oshero. Paminna kya takena. Oshero, oshero, oshero. Paminna kya takena. Choram papihime Shantana karin narori Choram papihime Shantana karin narori Pihita que te cate
Ukuy sunghoy banta runa simipi rimarimusah Pachamama Taitainti Mamaquilla. En la lengua de mis ancestros, Madre Tierra, Madre Naturaleza, Pachamama, estamos aquí para agradecerte por la vida que nos das, por la vida que das al mundo, dándonos siempre la luz del sol y la luz de la luna, regando los campos con la lluvia, a veces con tus lágrimas tristes, cuando nosotros, los seres humanos, no estamos sabiendo respetar lo que nos da la vida, el agua pura, el aire limpio, la luz radiante de noche y de día, que ilumina nuestros campos donde produce la vida de nuestros alimentos, la vida de los animalitos, la vida de la naturaleza y nuestra propia vida. Te ofrecemos este día, estas reflexiones, pidiéndote que nos llames a la sabiduría de las personas, de los seres humanos, para ser felices, para ser plenos, hombres y mujeres, mayores y adultos, animalitos y seres humanos. Queremos paz, queremos respeto y no más violencia en nuestros territorios, en nuestras vidas, en nuestros pensamientos y en nuestros espíritus. Que el día nos ilumine a todas, hermanas y hermanos.
Thank you, Tarcila, for those wise words and giving us energy and power. And now I'd like to introduce Dr. Kanem, who without further ado, give the word. Please, you have the floor.
Thank you so much, Anne. Excellencies, sisters, brothers, all who are gathered here, greetings. I am honored to join you from the ancestral land of the Munsee Lenape in New York City. We of UNFPA are delighted to welcome world-respected and recognized Indigenous leaders and human rights champions for today's dialogue on Indigenous peoples and COVID-19. We thank Ms. Ana Nurgam and Dr. Jose Francisco Calizay for your international leadership and presence here today. At the Nairobi Summit on ICPD 25 last year, Indigenous leaders told the world what they want. They want non-discriminatory, culturally appropriate health services, including sexual and reproductive health care as a priority. They said that the often widespread discrimination in healthcare that translates into disrespect of Indigenous peoples must end once and for all. And they advocated for greater public awareness and respect for traditional Indigenous knowledge and culture. This conversation today is coming at an important moment to harness the immense power of Indigenous peoples once again, to change the course of history. In the words of departed Sister Flying Eagle woman Ingrid Washinewatuk of the Menominee. The power for that type of change comes from within. It comes from having knowledge and vision. With such power, you can create community wherever you are. COVID-19 is spreading in many Indigenous communities, both in the global North and South, devastating communities that were already facing inequality and marginalization. The threats to their ancestral ways and lands, the poor health and education systems, food insecurity, and the impact of climate change are compounding the inequality that COVID-19 is laying bare for all to see. In the Americas alone, over 70,000 Indigenous people have had COVID to date. Our United Nations High Commissioner for Human Rights, Dr. Michelle Bachelet, recently stated that COVID must be recognized as a critical threat to Indigenous peoples. And women and girls are the ones who are bearing the brunt of the pandemic. They may be working in informal jobs. They may be the one caring for everyone else in the household and have less access to appropriate health services. Everyone must wake up to realize that we must look to Indigenous communities whose leadership and experience in caring for the earth and responding to disasters is strong. We look to mobilize and lead the charge with Indigenous women's organizations who are already rallying to protect their communities. They're drawing on their traditional knowledge systems, their governance systems and practices to address the pandemic. UNFPA indeed has a strong commitment to support Indigenous people's rights, particularly the rights of Indigenous women and girls, and we call for redress of these inequalities that Indigenous women are facing, as we stated loud and clear at the Nairobi Summit when we celebrated the 25th anniversary of the Cairo International Conference on Population and Development. Today, this conversation gives us a chance to reflect. For UNFPA, that reflection brings us to a deep willingness to do everything that we can to amplify Indigenous voices and concerns, and to move the agenda from words into deeds, into action on the Sustainable Development Goals. The great chief, Wilma Mankiller, she was principal chief of the Cherokee Nation, famously said, "Every day is a good day." With this illustrious panel, may we make this day be so, a very good day. And I look forward to learning from the discussion and thank Tarcila for starting us off with the blessing. Thank you very much, Anna. Back to you.
Thank you, Dr. Kanem, for your words and also setting the context of the panel. Thank you. And now we start the first round of the panel and the questions. And first, the order of the panelists was, as I introduced in the beginning, the same as the introduction. And we have sent beforehand panelists the questions, and we hope them to answer. And we give each panelist 5 minutes time to answer the question. And then we have the second round after that one with in between with a little cultural program, which will be a nice surprise for all of us. And then, but now, without further speaking, I'd like to ask Ms. Tarcila Rivera Zea the first question, and that is that you are a leading Indigenous women's rights advocate and a long-time leader. in Indigenous community. You were representing Indigenous women already in 1994, as we saw in the video, and at the International Conference on Population and Development in Cairo, and also at the Beijing World Conference on Women in 1995. And last year, you were also in Nairobi at the 25-year summit of the ICPD. Can you reflect on how far we have come in supporting Indigenous women's reproductive rights and choices, and how these issues have been impacted by the COVID-19 pandemic? Please, the floor is yours.
Muchísimas gracias, hermana presidenta del Foro Permanente actualmente. Muchas gracias, doctor Kanem, por la invitación y por este evento con todo su equipo. Y bienvenidas y bienvenidos, hermanas y hermanos que están en el panel. Y parece que soy la mayor y quiero desde la mirada de los pueblos indígenas y evocando a una hermana mayor de Venezuela, Noelí Pocaterra, ella dice siempre que somos personas de sabiduría acumulada y quisiera hacer honor a ser la mayor del grupo. En ese sentido, como esta es una conversación, fíjense que valen las historias y los procesos que hacen y explican por qué uno hace estas cosas por las que nadie le obliga, nadie le paga, nadie le dice anda, anda. Para mí es importante este momento porque al Fondo de Población de las Naciones Unidas, desde el movimiento de las mujeres indígenas, consideramos como parte de nuestra familia y nuestro proceso. Y esto tiene que remontarse, por ejemplo, al año 94, cuando en Río se hizo una reunión preparatoria y éramos 3 mujeres indígenas. Una comanche, me parece, Judy Sayers, de Estados Unidos, una maya de Guatemala y yo, y alguien de Brasil. Desde que era la reunión de la sociedad civil. Tengo que decir que Judy Sayers me llevó a Cairo y andaba con un cartel con su organización y en los pasillos me hablaban en inglés y yo les decía, yo no soy del norte. Me dice, pero tú tienes el cartel en inglés. Bueno, desde aquella época, hermanas y hermanos, tenemos que hacer un balance en positivo. Cuando se hablaba del crecimiento de la población, generalmente se culpabilizaba a las mujeres indígenas porque paríamos mucha gente. Y entonces, en algunos países y en algunos escenarios, éramos las mujeres indígenas y mujeres del sector popular prioritarias en la planificación y programas de limitación de familias. Entonces, cuando llegamos a Cairo, empezamos a apropiarnos de lo que significan los derechos sexuales, los derechos reproductivos, y pusimos un solo derecho, el derecho a ser informadas sobre lo que significan esas políticas y esos programas en nuestras vidas, en nuestros cuerpos y en nuestro pueblo. Pero lo más importante es que en el proceso hemos aprendido a decir en nuestras propias comunidades, queremos tener el derecho de decidir con quién casarnos, derecho a escoger esposo, derecho a decidir cuándo casarse y derecho a decidir cuándo y cuántos hijos tener. Eso lo aprendimos de Cairo para acá. Luego, ahora, a través del tiempo, podemos decir que la nueva generación ha incorporado en su agenda ese proceso en el que se complementan los dos derechos, los derechos individuales como mujeres y los derechos colectivos como mujeres indígenas. Entonces, la nueva generación incorpora esos dos conceptos indivisibles en su lucha por los derechos sexuales y reproductivos. Entonces, de Cairo a Nairobi y de aquí para adelante, tenemos clarísimo nuestros avances, por ejemplo, en el nivel global, cómo es que entendiendo los derechos sexuales y reproductivos, nosotras como mujeres, pudimos incidir en la Comisión de Estatus de la Mujer por la erradicación de la mutilación genital en el mundo, en culturas originarias o no, y sea tradicional o no, porque riñe con los derechos humanos fundamentales de las mujeres y de las niñas. Eso es un avance importante para nosotras. El otro consenso global es que todas las mujeres en el mundo, las indígenas, estamos totalmente claras que no queremos más violencias en nuestras vidas, en nuestros cuerpos, ni en nuestros territorios. La prioridad para evitar y trabajar para no embarazo adolescente, no matrimonio adolescente y no violencia sexual, ni explotación, ni trata, aprovechándose de la situación de exclusión y vulnerabilidad en la que se encuentran las niñas y las mujeres indígenas. Entonces tenemos avances de las cuales nos sentimos orgullosas porque hemos contribuido en ese proceso desde no tener escenario, desde no saber qué significa, hasta que hoy podemos hacer propuestas juntándonos a nivel global, esas 250 casi millones de mujeres indígenas en el mundo, y que nuestra condición de indígenas no debe excluirnos de las políticas nacionales e internacionales. En esta región, las indígenas de América Latina, en nuestra relación con el Fondo de Población y en los escenarios regionales, contamos con el Consenso de Montevideo, del cual 3 generaciones de mujeres indígenas nos sentimos orgullosas porque pudimos incidir en ese documento. Pero sí, el desafío más grande es cómo los avances internacionales en este aspecto también de nuestras vidas se haga realidad en las políticas públicas en nuestros estados. Quedo ahí porque tendremos que seguir dialogando, pero el camino está hecho, está abierto y creo que todos vamos sumando y poniendo muchas semillas y la nueva generación creemos que tendrá mejores condiciones y con mejores oportunidades porque el camino está abierto. Muchas gracias por este momento y seguiremos conversando.
Thank you, Tarcila, for telling you about your own personal history and also the advancement of the rights of Indigenous women and girls, and especially how you talked about our cultural practices versus human rights, and what could be, how that was then led into the action, and how that some of our cultural practices might be harmful for girls and women. So that's good for us to notice also. And also the other point you raised is that how could all these international agreements and international consensus of Montevideo, how they could be made reality in Indigenous communities. That's the conversation we will continue. Thank you, Tarcila. And next panelist is Dr. Mariam Wallet Aboubakrine. Mariam, you are a doctor and closely familiar with the issues of sexual and reproductive health and gender-based violence. How have you observed the reproductive health and gender-based violence has been impacted during COVID in Indigenous communities, and what has been the response of Indigenous women's organizations themselves in raising and addressing these issues? Mariam, could you turn your camera on?
Oui, merci Tarlas. Bonjour, merci Annie. Permettez-moi d'abord de reconnaître le territoire autochtone algonquin non cédé duquel je m'adresse à vous ce matin. Merci à toute l'équipe du FNUAP pour ces séries de conversations sur ce qu'est à venir pour les femmes, donc What's the Next for Women, surtout pour avoir consacré un des épisodes aux femmes et donc à tous les peuples autochtones, donc aux femmes autochtones. Je reviens à votre question, Madame la Présidente, pour parler de l'impact de cette pandémie sur la santé reproductive et les violences basées sur le genre. Il est important de rappeler la situation qui prévalait avant la pandémie. En tant qu'une femme autochtone, membre d'une organisation de femmes autochtones, médecin et ancienne experte des mécanismes onusiens sur les peuples autochtones, j'ai pu enregistrer plusieurs témoignages. J'ai aussi reçu des plaintes et observé des faits et fait des constats quant au déni des droits des femmes autochtones à leur droit à la santé reproductive. Il en est de même pour les taux de violence basés sur le genre. Malheureusement, cette situation n'est pas suffisamment reflétée dans les statistiques nationales ni globales d'ailleurs, d'où notre plaidoyer à l'élaboration d'une fiche descriptive sur la santé maternelle et la mortalité maternelle des femmes issues des populations autochtones, qui a été élaborée en collaboration avec le FNIAP, ONU Femmes et UNICEF. Bien que ces conclusions donc, de la fiche descriptive soient limitées en matière de représentativité, juste les données de 16 pays ont pu être récoltées et traitées. Elles révèlent les inégalités de santé auxquelles font face...
Excuse me, Mariam. We have problems with translation, so we try to get the English translation working now. And Peter, could you take over?
I would suggest, Mariam, that you continue, because for those of us who can follow, we will publish your remarks after the fact. There's some kind of a glitch, but we should continue. And what you're saying is quite interesting. So we will ensure that we have the versions available for the participants after. Thank you. Thank you, Anna. Sorry.
Okay, thank you, Annie and Dr. Kanem. Je disais, bien que les conclusions de la fiche descriptive soient limitées en matière de représentativité, donc juste 16 pays ont pu être récoltés, donc les données pour ces pays et traitées, elles révèlent quand même les inégalités de santé auxquelles font face les femmes autochtones. Par exemple, pour ce qui est du pourcentage des femmes n'ayant pas bénéficié de consultations prénatales, on a noté dans cette fiche que ce taux est 10 fois plus élevé chez les femmes autochtones sanes plutôt que chez leurs compatriotes en Namibie. De même pour les taux moyens de grossesse chez les adolescentes, donc pour 1000 naissances, il était 2 fois plus élevé chez nos sœurs amérindiennes de la Guyane comparativement à leurs autres compatriotes. Maintenant, concernant les violences basées sur le genre, il est important de souligner le caractère multifactoriel de leurs origines et la multiplicité de leur nature. Dans le cas des femmes autochtones, il y a par exemple la situation particulière de la surmilitarisation de leur territoire, des conflits et des situations humanitaires qui en découlent. Par exemple, les déplacements internes, les réfugiés aussi. Donc, cela expose davantage ces femmes-là à l'exploitation sexuelle, au viol, aux maladies sexuellement transmissibles, aux grossesses précoces et indésirables. Et il faut aussi mettre sur la table la question de certaines de nos pratiques, nous-mêmes, de nos pratiques traditionnelles néfastes. Je pense aux mutilations génitales féminines, je pense au mariage précoce et forcé, je pense également aux tabous autour de toute la sexualité dans certaines de nos communautés, de nos nations, la dénonciation aussi des violences basées sur le genre, parce que dans certaines de nos communautés, cela ne se fait juste pas. Maintenant, si nous revenons à cette période même de pandémie, il y a tout d'abord un confinement. Donc, tout le monde s'est confiné dans un premier temps. Puis, les différents acteurs, que ce soit les nations, les organisations, même les Nations Unies, se sont repliés sur elles-mêmes le temps de réfléchir, le temps de se réorganiser, de s'organiser par rapport à cette catastrophe, si je peux l'appeler ainsi. Donc, c'est qu'il y a eu différentes conséquences pour les femmes autochtones à différents niveaux. Par exemple, si nous parlons de la santé sexuelle et reproductive, là où les centres de santé, les soins de santé sexuelle, les soins de santé péri et postnataux sont disponibles. Ils ont accusé des retards, que ce soit dans l'approvisionnement pour la question logistique, mais également pour l'acheminement des personnels, parce que nous savons que dans certains endroits où les femmes autochtones sont, les services de santé dépendent entièrement des travailleurs humanitaires. Donc là encore, il y a eu une rupture de la chaîne, si je peux le dire ainsi. Pourtant, on sait que, et puis là, tout le monde s'est concentré à gérer la pandémie. Donc, l'urgence du moment était la pandémie. Pourtant, une grossesse à haut risque non surveillée pourrait être plus rapidement fatale du fait d'une éclampsie, par exemple, que la COVID-19, surtout si les populations en question n'enregistrent aucun cas ou si on ne dénote pas un risque réel de flambée de COVID-19 pour leur communauté. Maintenant, si nous voyons pour le cas des violences basées sur les genres, pour avoir participé à plusieurs rencontres et discussions de femmes autochtones sur la question, j'entends les femmes rapporter une exacerbation de ces violences basées sur le genre dans toutes les 7 régions socioculturelles autochtones, malheureusement. Elles se retrouvent, les femmes, enfermées avec leurs bourreaux, donc à leur merci. Les systèmes d'accueil et de plaintes déjà faibles, obstrués, se sont juste amenuisés. Et il est aussi important de souligner que la plupart des secteurs de travail qui ont été fermés du fait de la pandémie sont ceux où les femmes autochtones exercent leur autonomie financière. Je pense au tourisme, je pense au petit commerce. Et d'ailleurs, une étude menée par une organisation de femmes autochtones au Sahel et dans cette région montre par exemple une grande croissance des violences basées sur le genre. Si nous prenons le cas du Tchad, il y a eu une croissance de 30%, pour le cas du Sénégal, 15%, le Mali, 11% de croissance, Burkina Faso, 10%, Niger, 7% et Mauritanie, 7%. Alors, 5%, pardon. En somme, donc tout ça pour dire que la pandémie est venue révéler une situation déjà précaire vécue par les femmes autochtones et creuser davantage les inégalités sociales, de genre et de santé auxquelles font face les femmes et les nations autochtones. Je vous remercie, Madame la Présidente, et je vous remercie à tous et tous pour votre écoute.
Thank you, Mariam. I do hope we get an interpretation in place now so that it's easier to follow. And next one on is in the list of the panelists is Miss Janine Jassy. Could you please turn your camera on? Miss Jassy, you come from the Navajo tribe, which has experienced some of the highest COVID rates in the US. This situation reflects how the issues of inequality that we are discussing today are present in all countries, rich and poor. Could you share with us a bit more about the impact of COVID in your communities and share your thoughts on how we could draw on Indigenous people's unique Indigenous-led solutions for how we approach solutions in responding to the pandemic and creating a shift in the development paradigm, please?
Yes, thank you. Yate, good morning, relatives. It's been very sad to see my nation highlighted in the national spotlight for the impacts to our people as a result of COVID. And the disproportionate impacts are really rooted in a lot of pre-existing conditions and systemic inequalities that existed prior to this global pandemic sweeping across the globe. The pre-existing conditions from generations of environmental contamination have particularly impacted our population of women and children and elderly with a higher rate of health disparities that led to increased infection and more severe forms of COVID once they contracted the virus. And all of this sort of created the snowball effect in leading to more deaths and more cases of this virus in our communities. Other issues such as lack of access to clean drinking water because of the legacy of settler colonialism and the water and food apartheid that our communities have been held under also increased the rate of this infection spreading across our communities. And the impacts have been great. I know it's really hard to capture in terms of numbers, which are still very scary. We have almost 500 attributed deaths to COVID, but it really does not show the impacts to entire families and communities when you realize that these numbers represent whole families, knowledge holders, language speakers, people who are the sole providers of their households. All of this has created a situation that we haven't even begun to reconcile and to have the ability to grieve for because of all of the restrictions around maintaining social distancing and keeping people safe. And so a lot of these stresses, that's just like the direct impacts of the virus, but there's all of these other impacts that resulted from loss of income, which led to increased violence against women and children, increased poverty, increased food insecurity, and a lot of what people have been witnessing and experiencing with this onslaught against our people has led to increased suicides in many of our communities. And so as we move forward and as conversations around how do we build back better or build back, God forbid, to normal, this is where it's most important for us as Indigenous peoples to lead those solutions and those responses because of our experience, our lived experience and our understanding of with these endemic situations like of water insecurity, food insecurity, health inequality, energy insecurity, and lack of telecommunications access. And so coming from this, it's important for us to hold precious that it's not just about the loss of life, but about the impact to income, stability, the health of mind, bodies, and spirits that needs to be addressed if we are going to recover from this pandemic. And to recover means not to return to normal, but to build back better and smarter with holistic solutions that nurture food sovereignty, water sovereignty. And to do that, we have to take care of the land. And we can't take care of the land unless we take care of the people. For energy security and telecommunications development and building critical infrastructure that our communities need, we have to have decentralized solutions that honor cultural values. We have to ask the basic questions of what is energy development for? What is our vision for our communities so that we can make sure these projects are holistic, sustainable, and can be implemented while securing the land rights and upholding the inherent rights of Indigenous peoples to self-determination. For health equity, We need to have access to mental, behavioral, spiritual, and physical health services that restore the whole of each sacred individual. It's not just about access to clinics and hospitals, but also centering the importance of our traditional medicines, our traditional healers, and their role in the process of recovery. It's this holistic approach to development that is rooted in the deep understanding and love for all of our relationships and all forms of life. And it's also rooted in our responsibility to restore and live in balance with the earth and the universe, and to take this moment of deep reflection to understand what drastic behavioral changes are possible when it comes to the health, the resilience, and the safety and security of humanity. We can take these lessons and build upon this to really actualize the shift in the development paradigm that all of humanity needs. And I really, truly believe that Indigenous peoples have a very strong role in setting that direction and building those solutions. Thank you.
Thank you, Janine. And thank you highlighting the preconditions of the Indigenous, in the Indigenous societies, and also telling us about the solution, holistic solution needed. And now I turn into Ms. Pratima Gurung, and you are one of the most prominent voices in Nepal and Asia on the rights of Indigenous peoples with disabilities. One of the key challenges we have been hearing in the times of COVID is the issue of participation in national response processes. Can you share with us how you see the issue of participation has played out for Indigenous peoples with disabilities and some of the main challenges that they have faced during the pandemic? Please.
Thank you, Annie. Thank you, UNFPA, for providing me this opportunity. And I will begin my response with the data of Indigenous people with disabilities globally and nationally. Indigenous people with disabilities comprise of 54 million and 25 million Indigenous women with disabilities globally. And 45 million live in Asia and Pacific, and 1.3 million in Nepal. Having such a huge population, when I look at my position and my status, being an Indigenous woman with disability, I feel I am everywhere in the women and the disability and the Indigenous movement, but in fact, I am nowhere, neither in the women movement, neither in the disability movement and the Indigenous movement. So the question is, where am I? Where do I belong to? Where is my space? There are many existing realities of 54 million Indigenous people with disabilities having multiple and intersecting identities, both in normal and pandemic situation. We are not consulted, we are not engaged on the issues that impact our lives. Our participations is almost vacuum in all the issues that affect our life. We are most often voiceless. So the thirst of Sustainable Development Goal, reaching the furthest far, is an utopian, unfulfilled dream to us. Indigenous women with disabilities and girls face multiple and intersecting identities, and we face exclusion, marginalization, discrimination, both at public and private sphere in our daily lives. We are 3 times more risk and vulnerable than others. But these evidences and realities are only in few documents. Just to give you an example, the ICPD outcome document can be taken as an example. There has not been any COVID response intervention from the state, the development partners, the UN agencies. The single linear model approach exists within our mindset and within the existing policies. So the question is, are we really working in a right-based approach? Whom do we want to change? And will the existing approach provide a justice to groups like me who has multiple identity and who lies in the lowest hierarchy in the society. So a distinct identity as a woman, as an indigenous woman, and as a woman with disabilities. There are basic different needs that my multiple identity require. During the COVID-19 pandemic, I need a cathedral pipe, a regular medicine, a hot water bag, which is equally as essential as food. But I do not find any organizations, any civil society, any state mechanism who can provide these basic needs for me. I cannot wash my hands frequently, maintaining the COVID-19 protocol because I do not have my left hand. So the question is, do I have the right to remain safety like others? Do I have the right to live? So these are the fundamental questions that questions me every time, and I'm struggling with all these realities day to day. So there are many peoples like me who are waiting and who are waiting this and who are in these experiences, who are not getting this information, right to information about COVID in their local language, right to remain safety, right to have sexual and reproductive rights, right to get married, and right to get justice, which are overlooked during this pandemic. So there are a number of challenges that has been faced by indigenous girls and women with disabilities, like lack of support system, lack of gender, disability, and cultural friendly health and well-being measures. In my country and in Asia, we have increasing rates of suicidal, alarming rates of employment, lack of employment, violence, abuse, and discriminations are the realities of indigenous girls and women with disabilities. And there are many things that we have gone through, either in the pandemic or in the normal situation. Our efforts have not reached on the ground. So we need to work a lot. I will just stop here. Thank you.
Thank you, Pratima, for pointing out the rights of Indigenous peoples with disabilities, and especially women and girls. And it's a very good question you ask, that are we nowhere? And pointing out the documents of the different UN agencies that also Indigenous peoples with disabilities should be taken into account, and measures planned for all Indigenous peoples with disabilities. Thank you. And then now, next panelist is Dr. Kalia Zea. Could you turn on your video, please? You are the UN Special Rapporteur on the rights of Indigenous peoples, and you are preparing a report to the UN Human Rights Council on COVID-19 and Indigenous peoples. What do you see as some of the major human rights challenges in the responses to COVID for Indigenous peoples, including on the issue of violence against women? You have the floor.
Thank you very much, Anne. I will just say thank you very much to Dr. Natalia Kanem for the invitation. And I will start, I'm sorry, I just wanted to say welcome to all my colleagues who are in the panel also, and all to my brothers and sisters. Thank you very much for being here. I will start saying that Indigenous peoples in a collective memory is marked by pandemics, diseases such as smallpox, measles, and influenza were spread by colonizers, sometimes deliberately, ravaging and disseminating on their communities, especially and with more devastating impact suffered by women. In the COVID-19 pandemic, Indigenous people have already reported alarming levels of transmission among their communities and sometimes higher rates of fatalities. Respiratory infection, diabetes, cardiovascular illness, and HIV/AIDS, as well as malnutrition, are already common, and many indigenous people are suffering this illness. Often depending on fragile ecosystem for their subsistence, they also suffer particular health impacts from environmental degradation, including pollution of water resources and the traditional lands caused by extractive industries and pesticides from monocultivations. Indigenous persons with chronic health conditions or disabilities requiring regular medical checkups or treatment experience disproportionately the consequences of lockdown measures, overwhelmed national health system, and depletion of medical equipment. Indigenous people in voluntary isolation have reduced immunity to imported disease and are further from medical service. If they contract a disease in the Amazon, for example, these people are already on the brink of cultural extinction. They report exponential rates of transmission of the virus introduced by logging and mining workers, religious missionaries, and certain cases health professionals who have not been tested for COVID or quarantined themselves before entering their territories. Mental health issues and substance abuses are reportedly on the increase, particularly on urban context of overcrowded housing. The lack of face-to-face contact and mental health support for many indigenous people amplifies the harms of the pandemic. While community living practice such as extended family, and I understood what Tarcila said, that when we have this contact with our community, it's a better way to cure the illness that we are suffering. For example, food sharing and spiritual ceremonies practices are fundamental aspects of many indigenous culture. Measures adopted by a state to control the virus do not always acknowledge or respect their deep and particular importance for indigenous people culture. Across the world, neocolonialism and globalization contribute to dispossession of indigenous people land and keep their societies in a state of marginalization and extreme poverty. Indigenous communities are at increased risk because of the systemic inequities and discrimination they face, and COVID-19 has further exacerbated racism against indigenous men and women across all continents, including stigmatization when indigenous communities are accused of not respecting preventing measures or of having high infection rates. Indigenous people are also suffered consequences of food insecurity and lack access of clean water, soap, and sanitation. But if we are going to talk about how this is going to affect indigenous women, we can multiply by 3 times the situation of women. Discrimination as a woman, discrimination as a indigenous, discrimination as a poor person. So we can see that if we are going to analyze or just to share with the audience how is women are affected in this pandemic, we are going to, as at least I can say that, and I'm not talking about disability. If we are going to talk about disability, it's going to be multiplied by 4 times. And if we are going to talk about girls, we are going to talk about 5 multiplied by 5 times. So that is the situation that we are seeing in this moment in our indigenous communities, and how women are suffering a very high level of impact of the COVID-19 in this moment around the world. So I have many issues to speak about it because, you know, as you said, the report that I will send to the General Assembly and to the Human Rights Council, we have a lot of information in this moment. And it's very sad to see how the suffering of indigenous people is not only continuing, is deepening the suffering of indigenous people, especially indigenous women, and how we are going to see and how it's going to be accomplished. The goal for the 2030 is something that we have to see in this moment, because the situation of COVID-19 is came only to discover how indigenous people are suffering in this moment. So I will stay here and I will wait for the other questions. Thank you very much, Anne.
Thank you for highlighting the findings of your report. And now we have the cultural moment. And I'd like to introduce Janine, Miss Janine Jesse once again. And she will, Janine, thanks for turning on the video. Now the floor is yours.
Thank you. I am sharing a poem by the first Native American poet laureate, Joe Harjo. And it's called Remember. Remember the sky that you were born under. Know each of the stars' stories. Remember the moon. Know who she is. Remember the sun's birth at dawn. That is the strongest point of time. Remember sundown and the giving away tonight. Remember your birth, how your mother struggled to give you form and breath. You are evidence of her life and her mother's and hers. Remember your father, he is your life also. Remember the earth whose skin you are, red earth, black earth, yellow earth, white earth, brown earth. We are earth. Remember the plants, trees, animal life who all have their tribes, their families, their histories too. Talk to them, listen to them. They are alive poems. Remember the wind, remember her voice. She knows the origin of this universe. Remember you are all people and all people are you. Remember you are this universe and this universe is you. Remember all is in motion, is growing, is you. Remember language comes from this. Remember the dance language is, that life is. Remember.
Thank you, Janine. And now we have another inspirational moment with a song from Peru from Silvia Falcon. Silvia, over to you.
Muy buenos días con todos. Muchas gracias a todas las instituciones que hacen posible este espacio de reflexión tan importante en estos tiempos adversos. Mi nombre es Silvia Falcón, yo soy una artista dedicada a la difusión de la música peruana tradicional y comprometida con el reconocimiento de su valor estético, cultural y patrimonial. Esta mañana voy a compartir con ustedes un tema oriundo de las alturas del departamento de Huancavelica, aquí en el Perú. Se canta principalmente en las fiestas en honor al ganado para su multiplicación. Se llama Inti Lluximum, que en la lengua quechua o runasimi significa sale el sol. Muchísimas gracias.
Inayayipaj Mani sapanurpi mana taitayo. Inti yok semong wakan ayaipak kiya yok semong yakin ayaipak wakjaya tawakanyata cingka cispa parayata cikciyata mancakuspa. Inti yok semong wahan ayaipak kiya yok semong yakin ayaipak urhun puri muni wahakulyasting waihum puri kuni wahakulyasting. Compadre yay, comadre yay, asui kamuway, umarisun upiarisun, kusiri kusun, tumarisun upiarisun, kusiri kusun.
Thank you, Sylvia, for a beautiful song, and thank you, Janine, for a beautiful poem. And now I got remarks from our, or instructions from our, from the organizer, asking you to wrap up your second round. And the question is, what, in one word, what is the solution to tackle COVID-19 in Indigenous communities? And can you each one open your microphones and cameras and tell in one word the solution, please? And Mariam, can you do that in English? One word. Thank you. And Tarcila.
Okay, should I start?
One word.
Okay, thank you. So one word, thank you very much, and thank you for sharing all these cultural event. It was a very nice surprise. Thank you for our artists. So if I can say in one word, the solutions for me, this is very difficult because this is, as we describe the situation, it's hard to summarize what we need in one word, but let's go. This is a chance given for Indigenous women, and we will take it as it is. So for me, partnership, that is a part of the SDGs. So SDG 17 is the key for me. So partnership, because all what we are doing is affecting others. So we should go in partnership. Everyone has something to contribute. So we should emphasize on that and give Indigenous women and Indigenous peoples the stage. As our sister Pratima said, we need voices, we need to know what people really need, and we should not wait until the ending of pandemic to evaluate what has been done. We have to always monitor what we are doing, our commitment is, if they are followed or not, and it's not bad to reevaluate and to change how we are doing things. We should not be afraid to be innovative, to use a very nice tool that like UNDRIP, like also the system-wide action plan at country level for UN organizations, and bringing Indigenous women and their organizations on the table, because they are the experts of their bodies, their issues, and their communities. If you are really sincere in your commitments, give hands to those who have expertise, and let's be accountable also. Thank you very much.
Thank you, Mariam. Your word was partnership. And then I ask Pratima, what is your word? What is your word as a solution?
So for me, it's more about meaningful participation of young Indigenous women, girls, and women with disabilities. And we want a paradigm shift that focuses on the intersectional lens, and that includes reaching the most marginalized and leaving no one behind. Thank you.
Thank you, Pratima. And for you, the solution is meaningful participation. Thanks. And then Mr. Kali Zai, could you open your camera?
Well, it's very difficult to say a solution in only one word, because a historical injustice, discrimination, and marginalization is very hard for Indigenous people to say in only one word. I can think about a recognition of Indigenous people rights. I can say the solidarity with Indigenous people. I can say also respect of Indigenous people's rights. So there are many words that we can use, but only one word is impossible. I can say the respect of Indigenous people's rights.
Thank you. Thank you. And your word is respect for Indigenous people's rights. And then next one is Tarcila. Your one word as a solution.
One word in two is participation and recognition. It's necessary that to be account. We need to say where people decide about our life and our policies about us. That's very important. If we want to be part of the solution, we need to stay there and to be listened.
Thank you. So your words are participation and recognition of the rights. Thank you. And then we have finally Miss Janine Jassy.
I'm lucky because everyone already used a lot of the words I was struggling with and wanted to include. So to add to everything that my colleagues presented, I would say healing. Healing for our peoples, healing for those who are descendants of our oppressors, so that we can take this moment and reconnect to our responsibility to each other and to our world, to protect our most vulnerable and to build solutions that provide the quality of life that every human being deserves.
Thank you. And so your word was healing, which is really important. And all together, what your solutions, your words, they they give us a holistic view what to do next and what we are asking for. And it's meaningful participation, recognition of the rights, respect of the rights, and also healing. And thank you for all the panelists for giving your statements and participating, and hope that we can continue this discussion elsewhere. And now I give the floor as closing remarks for Dr. Kanem. I hand over to you.
Well, thank you, Anna. I think that it would be important in light of everything that we've learned today to yield some of my closing time to Dr. Kali Zea, because we've heard now that there is a report going before the Human Rights Council. And I have my team searching for the link so that we will post it because these are things that have been seriously thought about and discussed, and we're not starting today from scratch. So with your permission, Madam Moderator Anna, if Jose is willing, could you just give us an outline of what it is that your report is presenting and the ideas that we need to pay attention to going forward? Thank you.
Well, thank you very much, Doctor. I think that the report is going to come out on September, October. It's going to be public. But the main issue that has been taken from the reports that I have been receiving from Indigenous people organizations and Indigenous people leaders mainly is about the lack of access of health services. Also, the discrimination that Indigenous people, especially Indigenous women, have been suffering. The xenophobia is growing in this moment against Indigenous people because they have been accused to be the ones who are spreading the COVID-19 into other communities. And also, of course, the criminalization that has been taking place, especially because Indigenous people are defending their territories and their lands and their resources, because now in this pandemic and this emergency, world emergency, some states and some transnational, they are taking advantage of the lockdown that had been ordered or had been imposed to Indigenous people. They have been taking advantage of this, and they are not respecting the prior and informed consent consultation, and also they are not receiving the environment impact study. They are not respecting all those kind of things. So mainly that is the highlighted issue that I will inform and to report to the General Assembly and to the Human Rights Council.
Well, thank you very much for that preview, and thank you to you for the work that you're doing. As a special rapporteur representing the whole United Nations, be assured that we want to work together with you, that this is something that has centuries old roots, as we've heard in every presentation. But it's within our hands to take steps in partnership with all of the keywords that we've been left with, because it's a fight of everyone together. This is something that we all need to rally around. So I would really like to begin by thanking every single panelist, the wonderful moderator, our ability to start to engage together from all around the world, but realizing that we're united in a desire to see positive changes. I would also like to thank the sign language and French and Spanish and English interpreters. We still have to struggle to communicate, but it's important to do that. And we will also share written remarks that are submitted so that everybody can really think through what has been said. I'm really glad to see that hundreds of young people from all over the world have joined this conversation on YouTube, raising issues that the world urgently needs to learn, messages of anti-racism, anti-discrimination, of looking to safeguard the land and the planet. These are messages that the entire world needs to hear. So I will simply close with a reflection on my travels through Apache Mescalero territory. With my brother bird Running Water, I was able to witness the beautiful ceremonies that prepare adolescent girls in Apache into a prosperous womanhood. Everything from learning about medicine to being able to sing and dance appropriately during times of the year, to build your own teepee, to be able to fashion your appropriate clothing. It's the only time in all my missions around the continents of the world as a medical doctor and now as the head of UNFPA, where I have been able to witness fathers speaking with pride of their daughters, and to hear Apache men speaking of the transition with the onset of menstruation and the sacredness of womanhood. This is a nation where fathers go rejoicing to the neighbors to announce the good news door to door that their daughter is now on the road to becoming a successful woman, someone who will understand her culture, but also coexist in a modern world. Extraordinary. It's clear that as we think about the issues that Indigenous women are facing, UNFPA will have to do our best to work with you to involve all the members of the community of all ages. And some of you have highlighted the importance of the elders community as well. Now, this COVID response requires an intersectional lens. Everyone is in a different situation, a different particularity. We heard Pratima eloquently speak about the situation of Indigenous women and girls living with disabilities as one example. But in every geography, the risk, the context, the vulnerabilities that Indigenous people face are matched by the willingness to work together to find solutions. And I think Anna led us in a solutions-oriented discussion today. As the panelists have shared your perspectives and your solutions, I'm confident that there is a lot more that the United Nations can do, and specifically for UNFPA, we will do and are already doing things that contribute to these efforts. This includes our work on censuses, because Indigenous people need to be visible. They need to be valued, and we need to understand who is being left behind. We also have to make sense of a lived reality where someone who is being victimized is also being blamed. We have to object to this and interrupt that tendency whenever it occurs. To make the needs visible, we also have to focus on intercultural approaches to health. The health system can be very rigid, and we have to be able to adapt it so that it meets the needs of Indigenous people. And this would include in the maternal health delivery setting, when the birth attendants may need special considerations. And certainly I would have to underscore everything that everyone has spoken to. And thank you so much, Jose, on our efforts to address gender-based violence and not make Indigenous women victims any longer. For survivors, we also have to attend to our mental health. It was said earlier that the suicide rates are alarmingly increasing by our sister from the Diné Nation. We must make sure that the health system responds appropriately to give hope and comfort to people who have been traumatized, and UNFPA will be a partner in doing this. Most of all, I think we're gratified that Indigenous people have allowed us to listen to you at this table today, looking for solutions, but also admitting that the problems, many of them are not internally created. So we need partnerships in order to resolve some of these issues. And ultimately, I believe that this global conversation after ICPD 25 today should allow all of us not only to reflect, but to act. So I would like to leave you with my sense of commitment for UNFPA. What will we do? And that is to be sure that we incorporate the voices and understanding of Indigenous communities in the mainstream work that we do. So you don't have to be Indigenous in order to learn from the conversation that we had today. This is an offering that I think we should take very seriously, and whatever we can do to strengthen that across the system. Very happy to work with the Indigenous Peoples Forum and with Jose's team to do that. For us, this global conversation reflects our commitment to the principle of meaningful participation. Thank you so sincerely, each and every one of you, for your valuable contributions to this eye-opening dialogue, and we will keep the conversation going. Thank you so much. Back to you, Anna. Thank you.
Thank you, Dr. Kanem, for those words. It is so heartwarming to hear a promise from the Executive Secretary of the UN Special Agency. And here I would like to recognize the work of the UNFPA, UNICEF, and UN Women in preparing a fact sheet on Indigenous women's maternal health and maternal mortality in response to a 2016 recommendation of the Permanent Forum, which was proposed by Tarcila. And if I remember correctly, the fact sheet brings together the available data from 16 low and middle income countries on the maternal health status of Indigenous women and adolescent girls, analyzing the barriers behind these huge disparities and identifying actions that can be taken to close the gap. During this lockdown, there has been some good, and that has been the increased cooperation between the Permanent Forum and different UN agencies and programs. So therefore, we continue to seeking solutions when we have the meeting with the Permanent Forum meets the whole total Permanent Forum. All the members meet with the UNFPA later in September. And we continue this discussion and seek solutions in practice. And then likewise, a UNFPA during the summit held in Nairobi to mark the 25th anniversary of the International Conference on Population and Development in 2019 facilitated the participation of Indigenous women in response to a recommendation of the Permanent Forum. And that was again Tarcila and also Mariam's idea at that time, and which then led into the recommendation. And as well as other Indigenous women participated in session entitled Progress for Indigenous Women and Girls. In closing, I want to remind you that the right to health of Indigenous peoples is not thought an isolated medical program or act, but through comprehensive actions that respond to basic human rights and the rights of Indigenous peoples that have not been fulfilled up to now. I look forward to continuing our productive relationship. Thank you for all the panelists and for the UNFPA for organizing this very good panel. And Dr. Thank you especially for Dr. Natalia Kanem, who was behind all this. Thank you and see you and keep healthy. Thanks.
Don Pancho, levantemos la mesa.